Hi everyone. So today we're going to talk about how to do your cutover from the patient record. Cutover refers to taking some key information from the patient's physical record and putting it on the electronic health record as a summary so that your clinicians can see it to get some basic information. So let me show you how to do that now. I have a patient record open already, test MOCO, at the top of the screen here. And I want you to look at your left hand side by your clinical tree. If your clinical tree does not look like this, then we can talk about how to make it look like this in a little bit. Once you have this clinical tree, you're going to be looking for your patient summary. It says patient summary cut over from paper record. Once you find it, you're going to double left click on it to launch the patient summary. Now in this summary, we have a few data fields for you to fill out. First is source of information, and usually that is from your existing medical record. Then you have the author, which would be your institution. In this case, it's Mapen Hospital, but yours will say MOCO. And the transcriber, which is your name. Then we have the problem list. In the problem list, we record all the diagnoses that the patient currently has. For example, if they have diabetes type 2, if they have hypertension, we'd record it here. We also have our medication summary. In our medication summary, this is where we record all the medication that the patient is currently on. For example, they could be on amlodipine, 5 milligrams OD. Then we have our allergy section. Here is where we record whether or not the patient has any allergies. If they have no known allergies, we can select that button here, and the system will automatically log the patient as having no known allergies. If I click OK, we'll see it reflected in this viewport down here. However, what if they do have an allergy? For example, to penicillin. I can record that too. So I'm going to use this record allergy or sensitivity button. It's important to use this button. Here we can see drug sensitivity is already selected. And then in our drug field, which you can find here, what we're going to do is select the little pill bottle. Then in this search bar, we can select the drug that they are allergic to. So I'm going to pick penicillin. And I'm going to select search. Here I have several kinds of penicillin. The type doesn't really matter. You can select any one. When I select one, I have some other options that will show up. And again, I can select any option and click OK. Now you can see here that an example of the drug that they're allergic to is penicillin G benzathine. If I have information on what happens when they're exposed to this drug, I can comment on it here and click OK. And you can see the penicillin is reflected here. If I want to record another allergy, I can do that too. So say I want to say they're allergic to Panadol. I can select the pill bottle, choose Panadol, and I can pick any version of Panadol here. Another name for Panadol is acetaminophen. If I know what happens to them when they get acetaminophen, I can place it here and click OK. And now it shows up in my sensitivity and allergy summary. If the patient has vaccinations, we can record that too. However, it depends on whether or not the vaccination was recorded. If none was recorded, we can select no vaccination recorded. If a vaccination was recorded, we can select that, and we can place here whatever vaccinations the patient got. We can put the name of the vaccination, the date, and any particular reactions. We have another field for previous procedures. If the patient had any previous procedures done, we can place that here as well, and we can put the name, date, and location. We also have a pregnancy field. Now beside your pregnancy field, you have this little icon, and this is known as your preset notes. When you select it, you have a few options that you can pre-populate. You could either say it's not applicable, the patient isn't pregnant, the patient is currently pregnant, and you can also say the patient has been pregnant X times, they have X children, etc. And for pregnancy 1, you can enter the year, enter the outcome, enter any complications, etc. I'm going to put not applicable for now. However, if your patient is currently pregnant, it is very important that you use this button below called Record Pregnancy. This allows the system to log the patient as being pregnant. When I select Record Pregnancy, there's a form to fill out, but you don't need to fill out all this information. All you need to do is select date of first contact. For example, I might choose April 1 and click OK. And if you look at the right hand side of your screen, you can see that it now says the patient is pregnant and a fetus is recorded. This fetus has a unique identifier. It's important that they have this identifier because once this baby is born, this identifier will actually turn into a new record for that baby. You can also see any summary of the pregnancies documented here. Now our last field is our latest clinical synopsis. This is basically a summary of what the patient has been doing at the clinic. So you're going to use your preset notes again. And here we have pre-populated some information for you. So in your case, the patient is an outpatient. So you can select our outpatient format and click OK. You can say when the patient joined the clinic, the year and the month, what they're being treated for, and that they're being seen for follow-up. Inpatient has a similar format. And this is how you document your cutover summary. When you finish documenting, you're going to select OK. And you can see that any information that you put in the summary will show up here. So once anybody selects patient summary in the clinical tree, they can see this information. Now another thing that we have is your patient face sheet. This can be found here in your clinical tree. For your patient face sheet, once you double left click on it, you can see any summary of your patient information so far. You can see your patient details, and if they had any next of kin recorded, you can see that here as well. From this face sheet, you can actually update your patient details, for example, changing an address or a phone number using these buttons here. You can also record a next of kin here as well. So if you want to update your patient details, we can select update patient details, and we already see some information pre-populated. We can change our date of birth, change their name, marital status, telephone number, etc. If you want to record any contact details, we have our contact form here where you can update their mobile phone, home work phone, email, etc. For address, you can update their address using this pop-up here, and to record a next of kin, you can do that here as well. Thank you very much for watching.